session is a renowned personality in Unani fraternity. He is the most inspiring and motivating person. He is a known among all of us for his wisdom, hard works, and knowledge. I am here excited to invite my teacher, Dr. Muhammad Alimuddin Khamri sir, who is currently working as a professor and head of the Department of Jild Taziniat, National Institute of Unani Medicine, Bangalore, and he is the coordinator, Intermediary Pharmacovigilance Center for Unani Drug, Ministry of Ayush, Government of India, New Delhi. He has guided more than 60 PG scholars and 5 PhD scholars and more to come, sir. He has published more than 100 scientific and research articles, including original research papers. His area of research is musculoskeletal disease, Ilaj bit tadbir, psychiatric disorder, lifestyle disorders, and dermatological diseases. He has attended more than 60 conferences, seminars, workshops, and CMEs, and he has delivered a guest lecture in 10 international and 20 national seminars. He has organized 10 conferences, seminars, workshops, and CMEs. He is the academic in charge NIM from 2015 to till date. He is the member of various committee like Admission Committee Bangalore from 2004 to till date. And he is also the member secretary of Institutional Ethical Board Committee for Biomedical Research of National Institute of Unani Medicine from 2013 to till date, and also a member of Ethical Committee for Biomedical Research, UMC, Bangalore. He is one of the member board of study, Rajiv Gandhi University of Health and Science, Karnataka, Bangalore, and a member of editorial board Journal of Research in Unani Medicines. And he also a member of formulation committee of NIUM. He is one of the committee member for the preparation of draft manual for Unani Health Science College by NAC, and he also a member board of study Unani Thiruvallur University, Tamil Nadu. He is the reviewer of various journals like Cure-All Journal of Unani Medicine, Hyderabad, Journal of Research in Unani Medicine, Bangalore, International Journal of Unani and Integrative Medicine, Scientific Research Publication Journal, and Open Journal of Ophthalmology. He is the in charge as a resident medical officer. He has received various awards like Excellent Teachers Award in Hyderabad and Unani Day, Best Unani Day Award and Mosinetip Award from Kumga, Bangalore in 2017. He also received 10th National Award from Abul Hassan Ashraf Academy, Hyderabad 2018. With this brief introduction, I would like to welcome you, sir, to enlighten with your knowledge on the topic informed consent in health delivery and clinical research. And once again, I welcome you, sir. Please over to you, sir.
Thank you, Dr. Tapsia Kosa, for the very, I say that's a very impressive introduction. I'm very indebitable to you, all of you. I extend my greetings to the organizers of this program, particularly the Dr. N. Zahir Ahmad, the Deputy Director, Regional Research Institute of Unani Medicine, Chennai, who took a task and are consistently organizing several webinars in view of the International Unani Day celebration. I extend my greetings to the RRIUM team who are behind this webinar, successfully bring to the public domain for dissemination of the knowledge. I think the time allocated to me is 30 minutes only, so the content of deliberation is much more than the time allocated to me. Concising my acknowledgements to all, I extend my greetings to all of you. Assalamu alaikum and an afternoon to all. The topic which is it visible, Dr. Tapsia and else? Is it visible now?
Yes, sir, it is visible. Informed consent in healthcare.
Okay, and I hope so. This is also new. Yeah, the topic which assigned to me is the informed consent in healthcare delivery and clinical research. So here we have two components related to the informed consent. One for the healthcare delivery, particularly at the level of the patient in the hospitals, and a separate group of people who have been subjected to the research. The two categories of the people, how to execute this informed consent form. The next slides are going to give you an in detail understanding about the informed consent form. The outline of the presentation, which we are going to cover in the next few minutes, maybe of 20 minutes or 30, we'll try to understand what is informed consent and why informed consent is important for healthcare delivery as well as the research. apart from what are the things are the need, the background of the informed consent form, some elements of the informed consent form, along with different variants of informed consent form you would like to understand, followed by a brief conclusion. Coming to the part of my deliberation, the informed consent. Informed consent is basically is a written document obtained from the research participant with their competency and voluntariness in research study. This is what here. This is a written document asking the subject who is part of the study based upon his ability of understanding the content and
Second, sir.
yeah,
Sir, 1 second. Please check your slide is not moving, sir.
slide is not moving.
Yes, sir. Please share your entire screen, sir.
Stop sharing.
Now it is.
This is wanted to put just a minute. Sorry for this inconvenience.
The speaker, the sound is not that much audible as earlier it is to audible.
Yes, sir.
Okay.
Share your entire screen, sir. Sir, please play the slide, sir.
Is it now? It's okay.
Change to next slide, sir.
Yeah.
Next.
Why-
Now it is working, sir.
Yeah. What about the voice? Is it audible?
Yes, sir. Yes, sir. It is clear.
Okay. Sorry
Fine.
for the inconvenience. Yeah.
Thanks.
We are just trying to understand the definition. What is informed consent? And the major important question is why that informed consent is so important. The reason is because the law, ethics, medicine, and the researchers were all affected by issues of individual liberty and social equality in the wider society that makes us to be forcibly think, or it makes mandatory to understand the importance of the informed consent form. If you look at the history of the medical sciences, whatever it could be, either it is a conventional or the alternative system of medicine, some of the important works like Hippocratic writing, which were held somewhere in the 5th BC, and the another medical ethics in 1803, where Thomas Percival, they, sorry to say, they are disappointing from the perspectives of the right to give informed consent to the patient. But Hippocratic writing, they more emphasis upon the physician's ethics, where they say that do no harm. This is the only thing which is there, but they have not given any what is called the right to a patient to express their satisfaction and willingness about receiving treatment or anything else. Moving ahead, the reasons, the background of informed consent form need, how it has been arises. There are certain historical, I can say, the milestones in the history which makes us to be think forcibly to be execute the informed consent form. In the history of medical sciences, there are events like in the 1905, Dr. Brad versus Pramila J. Davis, basically a case of a woman who used to suffer with the epilepsy. Dr. Brad started treating the patient by doing the hysterectomy, saying, assuming that the hysterectomy will prevent the epilepsy of the patient. Here, this case is clearly indicated of without taking the consonants of the consent of the patient were hysterectomized for treating the epilepsy. This is supposed to be one of the historical case. Similar case is also been documented in the medical history is the Mrs. Anna Moore and versus Dr. Williams in 1905, where Mrs. Moore was suffering with the pain and hearing impairment in the right ear. Instead of that, Dr. William operated on the left side that causes further complete loss of hearing to the patient. And another incident which is there in the history is the Rolter versus Strain. It was happened in 1908, where a person met with an accidental injury, some granulomatous substance into the body. As a result, the lower limb was got infected. But during the process of removing the such infected material, the surgeon removed the sesamoid bone of the individual that causes a further appeal to the court of law. All these cases, they have sued into the court against the doctor without taking the consent of the patient. They did the procedure. Adding few more things to this, another event in the history is Marek Shkodov versus Society of New York Hospital that was held in 1914. Madam Mary was having that fibroid uterus. She approached the surgeon for the treatment, but the surgeon believed that the only treatment existing to control the problem of Mary Shkodov was a hysterectomy. Without taking the consent of this lady, hysterectomy was done. Coming to the historical point in the history of informed consent and this violation of the ethics, the post-World War II period, which lies between 1930 to 1945, particularly the Germans, Nazis' experimentation on humans. This is on the what is called as army soldiers to whom they experimented. They conducted the experimentation, the concentrated concentration camps in the Germany. That was purely unethical trials, which is merely a crime against the humanity. As a result, the matter has been brought to the International Court of Law. In the Germany, there was a place called as Nuremberg Court, where a trio American judges delivered a verdict called as permissible experimentation on human subjects. And this were permissible, what is called as the verdict, which is delivered in the form of a permissible experimentation on human subject, was brought in the year 1947 with considered to be a term called as Nuremberg Code. And this Nuremberg Code, out of several points described in that, one particular point emphasizes about any research or any experimentation where the human subject should be only to be carried out after taking subjects' voluntary consent. And in fact, this is the first international guidelines on the ethics involving research on the human subject, which emphasize more on subjects' voluntary consent is mandatory to include into the study. Adding few more incidents into the history of the need for the informed consent, Martin Salgo, Leland Stanford, a junior university board of trust in 1957, where the person had a problem as a awake of some translumbar orthography, he developed the paralysis. And ultimately, he sued against the doctor who, without consulting the patient, without explaining the proper pros and cons of the translumbar orthography procedure, he met with an accident, he met with a problem of paralysis. And the same thing was continued in 1960. Nathanson versus Clint, they also discuss about the case. A lady was treated for the breast cancer with a mastectomy, followed by, without taking the consent of the patient, she was given cobalt radiation therapy. As a result of post-mastectomy and cobalt radiation therapy, that lady developed several complications. And adding few more things, in the recent past, 1963, that's of course in the mid of the century, Jewish Chronic Disease Hospital in Brooklyn, New York, where the researcher injected live cancer cell into 22 healthy individuals admitted in the hospital, that is Jewish Chronic Disease Hospital. And the objective of this experimentation is to discover the effect of such a cancer cell injected into the body. Means they just wanted to see the course of the action of these cancer cells. This is one thing happened where there is no such a consent has been taken to the subjects. Another milestone in the history of violation of the ethics and the individual rights of the patient is Willowbrook State School study that was held somewhere between 1963 to 66, where mentally retarded children studying the school as a rehabilitationary camp there deliberately infected them with hepatitis virus, and the purpose is to observe the natural history of the disease. These are all several incidents. Some of them have sued into the court of law, some of them have been compensated. But another milestone in the history of violation of the ethics and the emergence of the importance of the ethical informed consent is the Tuskegee syphilis study that was held in United States of America between 1932 to 1972, that lasts for 40 years of age. Basically, this study was conducted by the United States Public Health Services, initiated this study in the early 1930s, and the purpose was to compare the healthy and longevity of the untreated syphilis, where particularly a group of African American male Negro population was subjected with this study. And the most unfortunate thing happened with this study is This Tuskegee study was reviewed several times between 1930 to 72, several times reviewed. This is the period where they're just looking about the outcome of the syphilis among the healthy individuals. Though the treatment of penicillin was available without providing treatment to the infected people, they have been subjected to this cruelty. Finally, 1972, the United States Department of Health and Education Welfare reviewed the policy and procedures of consent of the subject, which shows that there is a total violation of the procedure and policies of the consent of the subject in safeguarding the individual. So as an outcry, this has the biggest impact in the history of medical sciences. And during this period, in 1964, World Medical Association conducted a meeting in Finland. As a result of this 18th meeting of this World Medical Association 1964 in the Helsinki, a declaration has been brought, and that this declaration emphasizes more on consent of the subject has been made mandatory, without which no subject can be included into the study. Apart from, they have focuses on the content of the informed consent form. And another adding history is this Slattern and the Baker and Stapleton. There is another event happened in 1767. This is a very old one, where yes, a person had a problem of the fractured lower limb that was treated by the surgeon with the help of some device. Later, he learned about that the union of the fractured bone was not appropriate. So again, he rebroken the fractured part. And as a result, the victim appealed to the court of law, and the court gave judgment in favor of the subject, as the surgeon would have been taken consent of the patient before doing the procedure. And another important event in the history is the Canterbury and the Spencer, where a 19 years old boy who was suffering with the shoulder pain, and that finally it was detected that there is a disc rupture at the cervicothoracic area, and it was suggested that laminectomy can be done. This event was happened in 1972, that is during the declaration of the Helsinki. The doctor surgeon told the patient this laminectomy is a very simple minor procedure without any complication. But as a result of that laminectomy, the boy who had been operated had developed a paralysis, and the mother of the patient sued against the doctor surgeon without explaining the complications or the consequences of the laminectomy, victimized the patient. So there are several cases which makes us that as a amicus curiae, this is a Latin term which stands for friend of the court, people have appealed to the court of law because the unethical practices of the medical practitioners, surgeons, and the researchers as an outcry by the people and the public, more particularly in the 1972 three court decisions which were given by the courts of Canterbury Spencer, Cobbs versus Grant, and Wilkinson versus Vesey. They are widely recognized the importance of the informed consent form. Apart from that, these courts univocally accepted that the decisions are moved in the direction of more patient-oriented standards of disclosure in informed consent form. Means the Canterbury Court totally given a verdict totally in the favor of the patient, and the information should be disclosed. We should be more patient-oriented than not the surgeon. And as adding a few more things, the 1981 American Medical Association recognized first time the importance of informed consent as a basic social policy, which is necessary to enable patients to make their own choice, even if the physicians disagree. And these are all the events which makes us to think about the execution of informed consent form. In the history, there is another milestone called as the emergence of the Bellman Report. And basically, this Bellman Report is something like the pretext of the regulatory definition, which is included in the Declaration of Helsinki, which was adopted by the World Medical Association in 1964, and the public outcry against 1972. This study, which was conducted by the United States Public Health Services, that is called as a Tuskegee study for the syphilis, for untreated syphilis in the Negro males. It created that causes a lot of havoc in the different developed countries, particularly in America. As a result, the United States of America created a commission called as National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. and this outcome, this commission constituted in a committee to frame certain rules for the execution of this protection of the human subjects' rights in the research. This committee's recommendation was taken place between 1974 to 78 for 4 years. The commission developed an abstract schema of basic ethical principles of research ethics that gave informed consent a major role, and that complete description came out in the form of a Bellman report. This is the Bellman report. Adding some more information to the Bellman report, the Bellman report says that this Bellman report identified 3 specific concepts to the process of informed consent in the research to be incorporated, that is information, comprehension, and voluntariness. If you try to understand these 3 concepts, the concept of information which is to be there in the informed consent includes specific elements, which is to say that the research procedure, this research, that elements of this information should have what kind of research procedure is being given to the patient, and the associated risk and anticipated benefits should be disclosed. In case if it is not doing well, what alternative procedures you are going to say, this is to be disclosed. And moreover, a statement offering the subject, the research subject, the patient, opportunity to ask question and to withdraw at any time from the research is given in the information. And the second, the concept of comprehension states that the manner and the context in which the information is conveyed, which is equally important to the concept of information. And finally, the concept of voluntariness includes the competency, ability of the individual, and its decisiveness, the autonomy of the individual, whether he may not be the part of the study. So, at outcome of this Bellman report, which emphasized that informed consent must have these 3 concepts, specific concepts, out of which the 2 is information and what is called as the voluntariness. If you try to understand in elaboration, basically this informed consent is a combination of 2 words, information and consent. Here, the consent stands for the principle of voluntariness and competency of the individual. If a person who is voluntarily, willingly coming to be the part of any study with his own ability after getting understanding the pros and cons of the thing is given us by the consent. That information in the information sheet can be seen in 2 aspects. One is disclosure. The disclosure stands for what to disclose, what is to be expressed before the patient, how much to disclose, and in what manner to disclose. Whereas the comprehension stands for the language, the easily understandable words, where the information should not have any medical jargons, no technical terms, no phrases, no other difficult words to be incorporated into the informed consent form. These are all to be avoided. Coming to the structure of the informed consent document, basically this informed consent document has 2 parts. One is the patient information sheet, where a researcher is going to explain in detail about the information on non-facts about the research, which has relevance to the participant. And the second thing is the original informed consent form, where the participant acknowledges that he or she understood the information given by the patient information sheet and is voluntarily to be included into the research. So this informed consent document has 2 parts, patient information sheet and the patient informed consent form. Let us try to understand what the patient information sheet contains. I can say these are the elements of the patient, this informed consent form, where we have some of the important points like the study involves research, a statement mentioning that it is a research. The informed consent form, the portion of the information sheet must have a statement mentioning that it is a research, adding the purpose and the method of research, the why we are doing the research and what are the methods are going to be doing this research. Apart from that, expected duration of the study and how frequently the intervention will be given and how frequently you will be assessed for the study related outcome, and what procedures to be followed, whether you will be asked to come to the place of research or over the phone the data can be collected, or what kind of a procedures to be given. All the information should be available. Apart from that, we had, as a researcher, it has to be disclosed that any foreseeable risk and discomfort along with benefits to be mentioned. Any research is definitely have some pros and cons, so the thing should be disclosed in the information sheet. Apart from that, appropriate and alternative treatment or procedures ought to be disclosed. In case if the complaints of the patients are not good with the intervention in such case, or in case of any adversaries, what kind of appropriate measures you are going to provide, alternative treatment and procedure you are going to provide should be disclosed completely. And the extent of maintaining confidentiality is above all, because all the subjects need some sort of a confidentiality. As a researcher, when we have to disclose that, the matter will be completely taken into confidentiality, and the records, even identity of the subject, is also be kept in confidential. Likewise, any compensation or medical treatment for research related injury. As a subject, if any person who is the part of the study, unfortunately, if anything goes wrong, was there any or is there any compensation, like in terms of injury happened with this research related one, that has to be mentioned. And in case a subject wants to contact the person, to whom they have to contact for answers to pertinent to the question about the research, and research related subjects right also be disclosed. Here the form must have a statement called that is a purely participation is voluntary, and refusal discontinuing to participation will involve no penalty or loss of benefit. All the things will be extended as it is, without what is called as hampering to the subject who denied to the part of the study. Identity of the research team and contact person with address also will be mentioned in the patient information sheet. This is the information. Apart from that, there are just certain general instructions are there with the informed consent form. Informed consent form should obtain, who's to be obtained? By the qualified person. It is the responsibility of the qualified person, or a team of the people working as a researcher qualified. They have to obtain. Investigator is equally responsible for obtaining the informed consent form. And this is truly from each subject. No subject is exempted to be not to be taken the informed consent form. And more important, before the start of the study, these informed consent form to be obtained before the start of the study. From every subject, these informed consent form should be taken. Adequate time should be given to understand the content and the language or the material of the informed consent form, and allow the person subject to discuss these issues with the family and friends also. Sometimes because of some patients are very not competent to decide they themselves. So it is the responsibility of the research to disclose that enough time should be given to the subject to decide with the concurrence of the family and the friends. And study participant and investigator must sign the informed consent form. The general instruction is, once the study participant clear all the things, if they give their agree, their willingness, then it is the responsibility of the investigator to take participants' sign, signature, and endorse with the date and time. In case if the participants are illiterate, you have to take a thumb impression in the presence of some what is called as a person to whom he is not knowing. Some vulnerable populations are there, like senior citizen or a specific group of people suffering with some conditions. For them, legally acceptable relatives to be considered as that informed consent givers. Some cases there is impartial witness is also required. As I told you, in case of illiterate or children's are very a kind of a cohort where illiterates are unable to understand the language. In such a case, the complete content of the patient information should be revealed in the language where the patient is understand, in the presence of an impartial witness. That impartial witness means the person who is no way concerned to the subject, and the sign also be taken in the informed consent sheet. Okay, and likewise, in certain cases, audio visual recording of the IC process may be required, where there are exceptional cases are there. This is something like in the variants of, in the definition of the informed consent form, I told that this is a written document. Written document, and taking the cognizance of the patient is only possible when the patients are what is called as conscious, or they are in a state to give their willingness. But there are certain conditions where the patients are unable to give. In such a case, you can take audio or audio visual recordings also. And sometimes verbal, oral, And moreover, there are circumstances where you can go for a waiver of consent. Mean there is no need to take the consent is also there. Sometimes we need to take a reconsents also, maybe obtained. But all these conditions are subjected to that. You have to take into consideration of the ethical committee's approval. Then only one can proceed for this one. What are the cases where one can go waive off these informed consent form? That for this also, as I told you, there is an approval of the ethical committee, or the ethical committee may grant consent waiver in some of the cases, the following situations where researcher cannot practically be carried out without the waiver, and the waiver is scientifically justified. Mean exemption is scientifically justified in particular case. In that case only, with the concurrence of the ethical committee, no need to take informed consent form. And another group of the people, retrospective studies, mean looking back to the time frame where the participants are de-identified, cannot be possible to identify them and cannot be contacted. In such a case also, informed consent is exempted. Another group of things, that is the research on anonymized biological sample and data. This is very exceptional laboratory-based kind of studies where IC is not required. There are certain types of public health studies, surveillance programs, program on evaluation of certain studies also. Informed consent is not required among this population study. And the research data available in the public domain, generally nowadays, because of the availability of the internet, most of the things are kept on the public domain. If you wanted to do some sort of a data interpretation and drawing some inferences related to hypothesis generation, anything, this kind of studies are also exempted, no need to take informed consent form. And there is another important area where the research during humanitarian emergencies and disasters are there, where when the participants may not be in a position to give consent, also being waived off to not to take informed consent form. Coming to the different variants and special cases where the informed consent form to be obtained, particularly among the children's, because there is a particular definition of the children and particular execution of the point called as assent and dissent of the informed consent form. Let us try to understand, in all the cases of the children, parental consent should be sought. Here, the parental may preferably to be taken among both the parents. In case both the parents are not available, one is essential. Subject to that, the second parent should come and to do. Based on the extent of the risk, both the parents' consent is mandatory. Right. Child should be given assent. Assent is something like where the child agreed to participate in the research. After comprehending, explaining the importance of the research, because nowadays the children are also very good in understanding the research related issues based upon their intellectuality. So as a researcher, if we explain them, we comprehend them with the aspects of the research, if they give assent and agree to participate, then we have to go for a separate form is there for the assent that is to be executed among the children. Sometimes the children may dissent. Sometimes the children can be dissent. Dissent is something like they refuse to participate in the research. They have a complete right. Coming to the point, what is the age at where we can talk about the assent and the dissent is applicable when the child is? Any child which is less than 6 years of age, no assent is needed. If the children age is between 7 to 12 years, a separate assent is required with the approval of the parental consent. In case 13 to 17 years, assent section of the adult consent form may be used. Mean here directly they are considered to be only the consent form which is applicable to the adult people with the assent of the subject to be taken. In another direction are the guidelines which speaks about the policy of obtaining assent and dissent in children will be children between 7 to 15 years of age, only assent is required. After comprehensively explaining the pros and cons of the research. Children between 16 to 17 years of age, consent may be obtained, subject to that the parental or guardian concurrence is also mandatory. And the people who are more than 18 years of age, only consent has to be taken like in the adult case. This is with reference to the children. Here only the one format, one variant of separate variant of the informed consent form is available for the assent. The language is one and same like the patient information sheet, but here the statement which comprises that as a assent because of the age is some important information lying to the age group is there. Coming to the informed consent form among the women's, because women's are, there is something like there are some special situations which have equal right to participate in the research and should not be deprived of the opportunity of the benefit of the research to the women. But at the same time, the question is individual consent obtaining from the women due to certain cultural challenges become difficult. In case if it is possible, it is better to suggest the patient women to be consider consulting their family and husband or the guardian. After them, based upon their age, they can give the consent. There's existing consent form only applicable as an adult case. Uh, uh, there are so many cases where the patients are incompetent. Incompetent in the sense because of the age, their mental status, or sometimes like in an emergency situation. Some people are not competent enough to give consent, like mentally challenged people. It's very difficult to take informed consent from them. Elderly people, too old age people, and difficulty of vision and hearing. Neither they can able to see nor they can able to hear the content of this informed consent. In such a case, what do we do? There is a concept of proxy that is called as legally acceptable representative, or guardian will be made responsible for extending the research related benefit to the individual subject to their satisfaction. Directly, we cannot obtain this IC informed consent among these. This is a particular vulnerable group of a people. So it is better to take a LAR that's a legally acceptable representative. In case of incompetent person like illiterate or handicap, prisoners, a specific group of a people to whom we call as vulnerable also, same LAR will be applicable in such a cases. As I told you, there is another condition, there's emergency situation, and you wanted to do something best to the patient, where subject facing life-threatening situations. There are so many cases where, as a practitioner surgeon, we wanted to give some research drugs to the patient for improving the life condition of the patient. In such case, what you do, as an investigational product, therapy that could provide at least an equal likelihood of the saving of the person who is facing this life-threatening. In such a case, information cannot, I see that informed consent cannot be obtained. The reasons are because inability to communicate the patient subject. Sometimes there is insufficient time to obtain the informed consent form, and moreover there is a legally acceptable representatives are also not there. In such a case, it is the responsibility of the investigator determined and reviewed by another physician who is available for providing the treatment to the subject who is in emergency, who is not a part of the study, taking them into consonance. Straightforward, one can give this investigational product. The purpose is to give likelihood of the saving the patient, where there is no need to have an informed consent form. Oral consent form, there is another variant of this informed consent form is the oral one. This is something like a short form of a oral consent form. Oral informed consent form states the element of all the informed consent what we have told in the patient information sheet, which is presented to the subject or legally admissible representative. It is also necessary that to have a witness in a oral, that it is mandatory for the researcher investigator to have a witness for that one. And this oral information consent form should be approved by the ethical committee or institutional individual review board. Signature of the subject should be taken, or in case subject is unable to give the signature, then we go for legally admissible representative and the witness administering the consent. Copies of the summary in the short form should be given to the subject and subject representative to understand patient this. Name. Here I have a small document. You please see this. Diagnosed with. आप पे जो ड्रग ट्राई किया जाएगा उसका नाम है. इस ट्रायल से रिलेटेड सारे रिस्क्स और बेनिफिट्स आप समझ चुके हैं.
Dear delegates, kindly mute your audio, please. Sir, you may go ahead, sir. Sir, you are not audible and your slides are also not visible.
Yes, sir. That's what I also feel.
Sir, kindly unmute, sir. Kindly unmute. Professor Khamri sir, please unmute yourself.
Yeah. Is it okay? Audible?
Yes, sir.
Yeah.
Yes, now it is audible.
Okay. Finally, this is finally the conclusion. Oh God, conclusion of this presentation. If you look at throughout the history, the anecdotal evidence suggests that biomedical research often proceeded without adequate consent. But there is in the history, Walter Reed yellow fever experiment 1901, it seems to be the first formal procedure of obtaining the consent of potential subject, although this is also deficient by contemporary standards of disclosure and consent what we are today following. But the post-Second World War, Nazis' experimentation leads to the emergence of Nuremberg Code that is supposed to be the first guideline focused on the importance of informed consent form, which makes mandatory in human research, followed by the Declaration of Helsinki in 1964, even though post-Nuremberg Code, most the kind of a cruel and public outcry arise with a different violation of the ethics and the individual right of the patient. The biggest event happened with this Tuskegee syphilis study, which emphasized to come out of the standard ethical guidelines on research and particularly on the informed consent form that has been dealt in the Bellman report. Finally, I can say that informed consent form ensures the safety, autonomy of the research subject, which is a continuous process. Thank you for patiently listening to this one. If you have any query, question, I'm here to answer your answers, please.
Thank you so much, sir, for your valuable inputs regarding clinical research and informed consent.
Yeah.
Being a research scholar and working in the research institute, as we all know that informed consent is a very important part in clinical trials. As always, you lighten your historical background and need of informed consent to avoid adverse events as discussed above. Once again, I'm thank you, sir. I would like to inform all the attendees and delegates. If you have any doubts, please inbox us. We will have a last session in question answers, and we will try to get the possible solution from our expert. So now I look forward to our next speaker,
Thank you.
who can say that